Yeah, we're just gonna start the meeting. We have quite a few, agenda items. So we're going to start promptly. Before we start, we are going to, take roll calls and then also approve the minutes. Eric.
Amy,
Morning.
here. Adam, Alba, here. Eric, Claudia de la Cruz, here. Eric Diaz, here. Denisha Fields, absent. Anima Papana, absent. Mary Jane, absent. Troy Matt, present. Right, Robin, place, absent. Romeo Rao, absent. Ronnie, Nicodemus Rivera, absent. Arnett Scott. Absent. Carmen Perez. Present. No.
Okay, thank you. So we will get started. I just want, there's, first of all, there's, the Presbyterian Hospital here. Downtown Presbyterian.
Hi, I'm
Yeah.
here.
Oh, okay, thank you so much. Okay, so we'll start with you, but before we do that, I just want to give you some, I don't know if you were at the last meeting or last year, but it doesn't matter. But we're gonna have a refresher. We have so many members, and it's about the proceedings of the meeting. So you will give your presentation first, or, yeah, and you will be able to also, explain what the purpose of it is, right? So that's in the slide. So after that, we will take questions, the people in the room and also anyone who's in the Zoom. And what I do is that if you wish to speak, you raise your hand and I will put you in the queue. And so everyone will get a chance to speak, but you need to raise your hand. If I, the discussion is to be on the agenda item at hand, not another item. If I say, the discussion getting off track, I'm going to say something to put it back on track, then should get back on track. That's all I have to say right now, and, there's probably something else I can say. So, I'm sorry, what is the name again? Presbyterian? Sean?
Yes. Sorry, I'm just having a little trouble hearing you guys, but
Sean, you'll give your entire presentation first, and then questions come later. I'm
Yep.
gonna totally manage our time, okay?
sounds good.
Okay, so you can start.
I'm up first. I can go.
Yes.
All right, cool. Yeah, I'll just pull it up. Let's make sure you guys.
And so while he's pulling it up, he's giving a presentation about the results of their, maybe how it can be assessed. The hot seats. Just they were, get them, so you're just being. The meeting has started.
Okay. So, can you guys see my screen?
Yes, we can.
Okay, so yeah, hi everyone. My name is Sean Van Dyke, Community Engagement Manager with the Community Affairs team at New York Presbyterian. And I was there, I want to say last year around this time, maybe it was around April or June, and I gave you all an update that we were in the process of conducting our community health needs assessment. And essentially what that is it's every 3 years New York Presbyterian nonprofit hospitals in New York State are required to conduct an assessment of the communities that we serve. And so again, this is done every 3 years. Our last one was done in 2022. So 2025 marked the start of a new cycle. And what the assessment does, it identifies health and social issues in high disparity communities. And so once we are actually able to identify that, then we do what is called a community service plan, which details our interventions, our plans of actions to address some of those needs that were identified in the assessment. So when I was with you guys last year, we were in the middle of conducting the assessment, and I'm pleased to say that we finished the assessment and it was submitted to the state and the IRS at the end of 2025 in December. So I'm just here to show to provide some of the findings for you. And again, the process of this, just going back in terms of data collection and what that process looked like, we began the assessment by defining our service areas, and this was done by looking at our patient zip codes and seeing what areas these were coming from. And so, by looking at multiple data sources, we were able to identify consistent themes across our service areas. And so we did that through community surveys, receiving internal input from hospital physicians and community-facing staff. And then again, we also had looked at public data sources. And so again, once we had all this information, we were able to determine the high disparity communities, health conditions of greatest concern, and some recommendations that we received from the community to improve health. And again, just looking at the patient data, again, this was one of our data sources. We analyzed over 70 health indicators and reviewed over 300 literature review articles. We did over 1,400 surveys, which we're very proud of. And again, I want to thank you guys here because I know when I was here, I asked you guys to please share the survey amongst your community members, and the feedback that we got was outstanding. So we're very happy to say that received over 1,400 surveys. We conducted over 50 focus groups, which again is amazing. And then we held 25 key stakeholder interviews. And these were people like elected officials, people that really have their ears to the ground, what's going on in their communities. And as I mentioned, we also did what we call think tank sessions, which are essentially focus groups, but again, more internal. And so from the assessment, areas of high need for which New York Presbyterian serves are Lower East Side and Washington Heights and Inwood and Manhattan. And in Brooklyn, we're looking at Crown Heights. In Queens, it's Corona. In the Bronx, it's University Heights. And in Westchester is Mount Vernon and Peekskill. And so just showing some data as it relates to the Lower Manhattan area. Some of our key findings were that rates of food insecurity for Lower East Side residents are higher than citywide rates, which is 17% compared to 13%. 31% of Lower East Side households participate in SNAP, which is significantly higher compared to the 23% citywide. 34% of Lower East Side children live in households with income below the poverty line compared to 25% citywide, and 23% of Lower East Side renters spent half or more of their income on housing related costs. And then when we look at our community findings, when we last conducted our assessment, mental health, COVID-19, associated traumas, and alcohol and drug use were some of the top health concerns. And this year, diabetes, alcohol and drug use, and mental health are the top three. So diabetes and food-related health indicators have certainly made their way to the top, and it's an area that the hospital is looking to address. And then recommendations to improve programs, as you saw from the public data, housing access is definitely a key area where the hospital is looking to address, and so is education and neighborhood and safety and violence. And so some of the community service programs that we are looking to implement based off our findings are we're initiating a housing navigation program, as well as a food pharmacy and youth market. And then we also have what is called a transit program to address some of these health issues that we saw. And again, these are just a subset of our findings, our community programs that we're putting in place. More information, more detailed information on the hospital, of all the hospitals, community-facing programs can be found by scanning the QR code here. And again, I also want to mention that the full community health needs assessment is up on our website and can be viewed at any time. It is pretty long. I will say it's about 300 pages, but we do have an executive summary as well to, highlight some of these key findings that we just detailed. So I will end the presentation there.
Okay, thank you. All right, so now we will take questions. Okay, now, this is what I thought, I didn't we have quite a number of agenda items, so I'm going to give about maybe 10 minutes for questions and answers. You know, people online or person here. Okay, and if you're on, for those who are online, I think I mentioned this before, but I'll mention it again. If you're online and you wish to ask a question, you should raise your Zoom hand, and then someone will come over. That you can do and see.
It's the presentation, but we're going to somewhere in the same comparison. How it needs to change since sign it at the customers.
Yeah. You have to really do that.
Can you hear me?
Sorry, if you guys are talking, I'm having a very hard time hearing any questions that are coming in. I apologize.
Can you hear better on this mic? No? Worked fine last night. What?
That thing looks great.
Hi, Sean.
Hi. Yeah, I had my volume all the way up, but it sounds like you guys are very far away.
And Sean, I'm wondering if the needs statement addresses or touches on Beth Israel's closing and how that's affected the needs of the community.
Might also help if you turn on your show action.
That's sorry, can you repeat that question one more time? I had.
Does the statement address how Beth Israel's closing was addressed or has changed the needs of the community?
How Beth Israel? That wasn't a part of our assessment. So I'm sorry, I can't really speak to that.
I think it's better if it's probably worded this way, in your study, has there been any mention that the closure of the hospital affected their access to care in any way?
So access to care as far as New York Presbyterian is definitely something that has come up and is something that was raised in focus groups. As far as the volume increase from closures in the surrounding area, that I can't really speak to. I that wasn't really part of our assessment. So unfortunately I can't.
What is your assessment area? How far north does it go?
So our catchment area is we have Lower East Side. I don't have the exact zip codes, but it's just Lower East Side is our priority neighborhood for Manhattan, along with Washington Heights and Inwood. We use neighborhood tabulation areas. So
What are the neighboring tabulation areas that you use?
I can.
Is that in the report we go online? Is that in your report? The neighboring tabulation areas?
The exact ones used, it should be in the appendix. I'm sorry, I don't have that offhand, which the exact. Yep. I'm sorry.
Okay, thank you. Are there any other questions? Troy?
Thank you, Sean. I appreciate you. Dr. Troy Mack, I have a question for you regarding forward movement. Now that the CHMA is complete, do you have any awareness or can you share us sort of on the processes and timeline that the hospital is now gonna use? Where it talks about funding and implementation of those programs that you mentioned, and specifically how those budget conversations.
Yeah, so those programs that I mentioned, they have been implemented. And so part of the process is that we send annual updates on our progress to this state. And so we also do make those available publicly as well, um, within the 3-year cycle. So those are and you can see in the report, in our community service plan report, we state what our measures are and what our goals are. So those are available, and you can see how we are progressing towards meeting those goals.
Right, so the last time that report was mentioned up in Albany, we were told that in the next 90 days, we would be able to have that kind of information because it wasn't currently publicly posted. Do you know if before Labor Day or at least before the quarter 26, we would have a sense of what the budget allocation for these new community responses will be?
I don't know the budget piece of it. That is a separate department that speaks to that. I will say that some of our budget is reported in our community benefit that the hospital reports. And so that type of information will be made available so you can see kind of how much funding we are implementing towards community service programs, which is pretty substantial, especially compared to other hospitals.
What else? Comment?
Okay, once again, thank you so much for the showing. I remember when you came to us last year. But within a year of a lot has taken place. And in looking forward, especially with the passing of HR1. And mentioned freedom and security on the one end. And general health concerns on the other end. And we're looking at after November, cuts to SNAP and cuts to Medicaid. Is there any kind of report that pretty much forecasts any of this? Or how is it that the hospitals are going to have to grapple with this issue? Just yesterday, I was in conference with both DSS, HRA, and the Department for the Aging as to how we're gonna move forward with all this going on. Cause I foresee a major scenario.
Yeah, I mean, so that's definitely, something that the hospital is looking at as far as those types of policies and regulations that's outside my department. What I can say though is that in terms of, the cuts to SNAP, especially specifically as it relates to the community health needs assessment and community affairs, is that we are providing grants to community-based organizations that are doing food insecurity work. And so we're providing grants up to $300,000 to partner with local community-based organizations again that are providing some type of food insecurity work to benefit the community. So just to help augment, some of those cuts to SNAP that we're seeing, just partnering again and supporting our local partners who know their community members best to just help augment that. But in terms of, regulations and other procedures, that's more of a different department, so I can't really speak to that. But I just know that is something that the hospital is focused on and supporting.
Thank you. Any other questions? Okay, so I think that wraps it up. Thank you for coming. Did that say the report was currently on the website?
Yes.
On the hospital website, so we can get it more close.
Yep. Yeah. I can send out the link and I can follow up and send any other details and information as well.
Okay, that would be wonderful. so much.
Thank you.
Ariel?
Ask if she needs to share screen.
Yes, I'm gonna, Alexis is the executive director of the 14th Street Y, but I'll be presenting the slides as she speaks.
Oh, okay, we need,
It looks like I have access, so I can start whenever you give us permission.
Okay,
you're right, said before about, what you're right, talked about, the procedure for the presentation.
Sorry, I didn't hear you.
Okay, so, yeah, okay, so you're going to give it,
Alexis,
running the slide, by someone else giving the presentation.
yes, Alexis, who's also on video.
Okay, and so you will, Alexis will give her presentation first, the whole thing. And then we will take questions and answers from the room or on the Zoom. Those are ask a question, you should raise your hand, the full hand, and somebody will, we will, promote you so you can speak. And for those of the members who just have in, and you're new, if you wish to speak or ask a question, you raise your hand, I will put you in the queue, and you will have an opportunity to speak, or you will be speaking. If I see that the discussion kind of veers off course, we are to actually just talk about the agenda item at hand, but sometimes we digress and we go way off course. So I will say something so that we get back on track. Okay. So that's all I have to say. And Alexis?
Yeah.
Alexa, you can get started.
Great. Can you all hear me?
Yes.
Great. Okay. I'm Alexis Offen. I am the executive director of the 14th Street Y on 14th Street between 1st and 2nd Avenue, and the Sirovich Center for Balanced Living on 12th Street, which is a older adult center as well. I'm joined by Ariel Halpern, who not only is a program director at the 14th Street Y, running an addiction and recovery program, but also a resident of the district as well. And the purpose for us of coming to Community Board 3, and we're very grateful for this opportunity, is the Y is really always looking for new ways to be a good neighbor, for partnership, and how we can serve the community, both at the Y and at the Sirovich Center. So I'm going to walk you through some of our programs. I'm happy to take questions at any point, and ideas. And thank you again to Susan for setting this up for us. So just to see where we are placed within the district, we're obviously at the northernmost border. I'm not sure how many of you have been to the 14th Street Y, but we are downtown's Jewish Community Center, that we serve the entire and much broader community. And what you'll find in the 14th Street Y is not only just our fitness centers, but also our theater, our basketball court, our preschool, and an array of programming that we do in the building. And on 12th Street, we operate our older adult center, which has a meal program and a number of services for older adults in the community as well. So 14th Street Y, we have a number of programs. They span everything from early childhood, which is infant and toddler, through preschool. Youth, we have a very vibrant and well-subscribed after-school program where we pick up from area public schools and bring children to our building and provide programming for them until 6 o'clock, which is important for working parents. Fitness, aquatics, arts, addiction support, culture, Jewish life, and programming for older adults. We have 400 full-time and part-time seasonal staff. A good portion of that is seasonal staff related to our summer camp, which we operate on Staten Island. And we're part of the Educational Alliance, which is located on the Lower East Side, and is a network of community centers that includes not only the 14th Street Y and Sirovich Center, but the Manny Cantor Center, the Center for Recovery and Wellness, and an after-school program in Title I schools called DYCD. So I thought we'd start by talking about the Sirovich Center for Balanced Living, given that this is the Social Services Committee, and we do a great deal of social service work here. So this is a center funded by the Department for the Aging. We provide free membership for adults ages 60 and above. We provide hot breakfast and lunch, health and wellness programs, arts. We even have a ceramics program. We have art studios, all available to the older adults who attend. Education and social services, including licensed social workers and case managers. We provide one-on-one support with benefits, housing, counseling, and provide community. And our aim is really to help older adults age with dignity and remain connected to community. Our overall goal, whether it's at the 14th Street Y or at the Service Center, and really both, is to keep our services vibrant and our fees as low as possible. We provide scholarships through fundraising to various programs that charge a fee, and we are able to offer some services for free or very low cost through grants and government support, and we'll highlight both. Our membership, I joined the organization a little under 3 years ago. Ariel joined more recently, but we really feel that we've become really a turnaround center for the community. Our membership is at its highest level in more than a decade. We welcome a very diverse set of families and older adults, artists, immigrants, longtime residents, and we are a community gathering point, particularly from preschool families to older adults and everyone in between. One of the initiatives that we are always eager to get the word out about is Downtown Together. We founded this in October 2024 based on our identification of the need to really combat social isolation and the role that Jewish community centers can play in the broader community in doing that. So through a grant from the Jewish Community Relations Council, we have partnered with the Chinese American Planning Council, Vision Urbana, and community leader Daisy Paez to create an array of free clubs and classes that will bring together a diverse set of New Yorkers to find common interests and community. So our free clubs include everything from a cooking class that explores cooking and food culture across various cultures, film discussion group, salsa dancing, knitting, book clubs. One of my favorites is conversation through community, and in which people talk about cultures and community and an array of sort of life issues. And the idea is really to bring people together. We've had 428 people register for Downtown Together's free clubs. We held a celebratory Downtown Together community dinner just last month that over 56 people attended that featured Puerto Rican food, Ukrainian food, Chinese food, all from local vendors. And it was really a celebration of the sort of collective of what it means to be part of Downtown Together. And this fall we'll be kicking off new clubs and inviting more people in. So anything you can do to help spread the word is welcome. Another community-wide program that we do is the Celebrate Arts Festival, which showcases older adult artists. We have gallery exhibitions, performances, ceramics, poetry, and intergenerational programs, including intergenerational tap. This is held every May, and it creates visibility, purpose, connection, and community for older adults, and that's something we're very committed to. I also just want to touch on the fact that we have a health, fitness, and aquatics programs. We have a heated indoor pool, we have group exercise and wellness programs. We also have this, we participate in the Silver Sneakers program, which is funded by a number of insurers that provides exercise classes for older adults at discount. And we offer senior membership as well. For our youth and families, we have our preschool and after school programs, which largely support working families. We pride ourselves on how inclusive our program is, and we provide support to both neurotypical and neurodivergent youth. We're really attentive to all of those inclusionary pieces. We provide safe spaces for learning, creativity, fitness, and community building, and we offer Jewish and multicultural programming that reflects that. Some of the data about what we're doing and accomplishing: we have 1,700 fitness members, we have 300 families participating in infant and toddler programs, over 100 families that send their children to our after school, 900 plus summer campers, and 1,600 plus Service Center members. And we offer affordable access through scholarships and financial assistance whenever we can. Our goals for the organization and why we're here today and we'll continue to partner is for cross-cultural partnership and neighborhood collaborations, intergenerational engagement, community events, holiday celebrations. We want to provide healing, connection, and care. We want to help vulnerable residents, and we want to invest in community-based services and be a resource to everyone. We were told that this committee would have a particular interest in the areas of need that we're seeing in the community. I heard someone mention SNAP benefits earlier. We are concerned about older adult food security and meal programs. We've actually expanded our pantry services to meet those needs as we can. We provide mental health and aging services to do that. We're also seeing greater need for scholarships for children, families, and older adults that we're looking to fill through philanthropy. Our building, for those of you who've been to 14th Street Y, we have not made major capital improvements since the early 1960s, and so we have building infrastructure challenges. We also have greater security needs than we did at one point. And so those are both areas of focus for us in terms of the building on 14th Street. And another concern for us, particularly with the Saravich Center and in general, any provider of contracted city services is on-time payment from the city for our contracted services. I want to take this time to thank you for your partnership, and I'm happy to answer any questions, as is Ariel.
Questions?
And I'm having a bit of trouble hearing in general, so if someone can speak very.
Okay, so we need to speak like this?
That's wonderful.
Okay, so Adam has a question.
Thanks for the presentation. I'm wondering about the mental health and addiction services that you guys offer.
So we have sort of two paths within the 14th Street Y Saravich Center. We offer direct mental health services for our older adults in the Saravich Center and Project OR. And then in addition, we have a program called SELA, which Ariel actually oversees, which relates to addiction. And Ariel, maybe you can speak about what SELA does and also about what the Center for Recovery and Wellness does, which is part of the broader network that we're in through Educational Alliance.
Yeah, absolutely. So the Center for Recovery and Wellness is a clinical licensed facility that helps people with their addiction challenges. It's professionals helping people. They have social services. They have a residency. People live there and they can get better there. SELA, which is based at the 14th Street Y, a fairly new program, we create community for people who are in recovery. Sorry.
I'm following my chairman.
Go
ahead.
Yeah, okay,
That's why
we just did not
video
video
ads.
we're so good.
We're good.
Sorry?
Go ahead.
Oh, and SELA
We control the volume with this.
and SELA, which is the program I run at the 14th Street Y, is a community for people in addiction. We help people who are on the path of recovery stay on the path of recovery by providing them programming, events, support groups that help them sort of stay on that path. Our intention is to create that community that's authentic, that's real, allows people to show up honestly. And we do all kinds of programs. We have a group every night of the week. We do a Shabbat dinner, which is a Jewish dinner that occurs on Friday night. Everyone is welcome. Major holidays, we do programming. As you know, holidays can sometimes be a challenging time for people experiencing addiction if they can't go home, but they still want to experience and be in community. And we do all kinds of workshops as well, and I'm happy to talk more about it.
So you have group therapy, you have things like medication management or like care coordinators, social workers who can set up services for folks?
That's more the Center for Recovery and Wellness, which I believe is located on Avenue D. And that is both inpatient and outpatient programs.
Okay, thank you. Who would like to speak next? Is Tahisha?
I have a question about that, the mental health and the addiction services. Is it referral or is it a walk-in base?
At the Center for Recovery and Wellness,
Yeah.
I believe both can be accommodated. I don't know directly, that is another center, but we can always, we'd certainly arrange for them to come present as well.
It's referral.
Eric?
Hi.
Hi.
Yes, hi Alexis, can you hear me?
Yes.
Wonderful. First of all, thank you for the shout out. Mission Bob is proud to be part of the Downtown Together initiative, which I'm the executive director of. So proud to do that. Question, are there any capital needs that the center has that, can be helped? You have a new council member in office.
Yeah.
You know pretty well, I'm sure, our beloved Harvey Epstein.
He's been outstanding.
So just, and the district needs time, so I don't know if this is a community center that has some needs. Just curious to know. And then the follow-up and last question is just, some great services that are there. One of the things we're trying to bridge the gap is between some of the local NYCHA communities to take advantage of this center. It's a little bit out of the ways, not too out of the ways, but what are some thoughts of programming, strategies about how to sort of bring some of that good stuff there, make it more accessible to the NYCHA residents?
Yeah. So in terms of capital needs, I should start by saying, so we operate in a building on 14th Street that is owned by the United Jewish Appeal Federation that we lease from them. We have a long-term lease. Whereas on 12th Street, we are a tenant in a multi-tenant building. It's an SRO operated by Volunteers of America. So there we're really a renter, whereas on 14th Street, we're effectively the owner. And we will be launching a capital campaign at some point to modernize and refurbish 14th Street. Harvey Epstein has been extremely helpful on that front. I hope to have more announcements and share at some point, but he's been a real partner on that, and we're going to have significant needs there. And yes, he's just been a great partner to us. Your second question about partnering with NYCHA facilities, Daisy Paez, the person I mentioned as a partner in Downtown Together, is a NYCHA organizer and resident and former employee, and she has been really instrumental in bringing NYCHA residents into Downtown Together. And then we have an array of programs where we, for working families, non-working families that, I mentioned earlier as well, that we're always happy to make connections and build bridges. Daisy has really been a point person for that for us.
And she's also a board member. Okay, Susan.
Yeah, I was just gonna say, we are working very closely. Daisy's a board member. Arnett, sitting a few people over, works at your wellness center, and
Okay.
that's besides Eric, so.
Okay.
So we're-
You guys have it covered already. Okay.
Partnering without knowing. I had a couple of questions. I'll list them all and then you can answer. On the after-school programs, is that after school or is that at the Y?
It's at the Y.
As far as the demographics, people at the Y equally defined, like from north of 14th and south of 14th? And then I was also curious about your work with Title I schools. What is it you do with those schools?
So let's see. Your first, I feel like the after school is at the 14th Street Y. We pick up from local public schools, and that's a fee for service program where families are paying us for the enrichment program. In terms of the demographics of our membership, I would say it's equally distributed from above 14th Street and below, because we do draw a lot of Stuytown residents, which of course the southernmost point is on 14th Street on the north side of the block. In terms of the Title I programs, that's not part of the 14th Street Y. That's part of the Educational Alliance. And that is a program they have called DYCD that operates in a number of the public schools. It's not an area that Ariel and I are involved in, but I can certainly, ask them to come speak to this group as well, if that's of interest.
Okay, we work with them too. I said, that's okay, we work with them also.
Great. Separate from, but complementary to the 14th Street Y.
Troy?
Good evening, and thank you for this. Eric already touched on sort of the capital funding question. You mentioned earlier delayed payments and how that's impacting the 14th Street Y. Just out of curiosity, how long back payment are you owed at this point? Are you looking at 90-day window, longer than that? How's that going, and how is that impacting your ability to plan for provision and expansion for.
I had trouble understanding the question line by line, but I believe it was about the backlog of city payments.
Yes.
Okay. I mean, it's something that we're always managing through. I don't have any immediate data. You know, part of the benefit of being part of the Educational Alliance, which is a much larger $60 million organization, is that we have the capacity and cash flow to like be sustainable even when we have to wait for payments, but it really is not ideal and it's not, it presents fiscal challenges, but it's less of a dilemma for us than probably some organizations, but it is a real one that we cared about.
Thank you very much, appreciate it.
Yeah.
Okay, I'll take one or two more questions and then we will move on. Okay, so it looks like that's it.
Great.
And thank you for the presentation.
Absolutely. And again, anytime you need something from our Jewish Community Center or the Sirovich Center, really anything, we are more than happy and open to discussion. We're really happy to be here tonight.
Okay, thank you very much.
Thank you.
Thank you.
Bye.
Bye. Okay,
What?
we should always have one good speaker.
No, just when you speak, turn it on when you speak.
All right, so the next agenda item we have, I wanted to do, is there any cap of CEC report, do something short, before we get on district needs, which is long. Okay, but before we go on, let's have some introductions, because we did not do introductions, we just jumped into the meeting because the speakers were already here and we were starting on time. But we do have 4 new members here today. And so can all of us just introduce ourselves so we at least know each other's names and faces? So my name is May and I am the chair. Oh, we're this way. Yeah, okay.
Good evening, everyone. My name is Carmen Perez and I'm a public member.
And I also just want to note, this Carmen has been on me for about 8 years, but she is, this will be her last meeting. She decided that, she will not, this. She's gonna go on her break.
school.
You know, the public member appointments are every, like, they start around now July, so she's not gonna continue next year. But we will see her, she only works 2 doors down. Next,
Adam, the new members.
Hi, I'm Troy Mack. I live here in Livermore and Louisiana. I'm around the nonprofit and public sector. Thank you, Jim.
Hello, my name is Tisha Fields. This is my 3rd or 4th year. My background is mental health counseling and play therapy.
Hello, my name is this is low. I can even. Okay, hello, my name is Arnett Scott. I am board member before during COVID, so that's usually my time frame. So COVID, from COVID to now. Thank you. 6 years.
Hi everyone, my name is Mary Sloan, one of the new members here. I'm really excited to be on the subcommittee.
Not a member. Susan Stetzer, district manager.
Good evening, everyone. I'm Claudia de la Cruz and I'm a new member and I'm excited to be here.
Hello, everyone. My name is Eric Diaz. I'm a community board member since 2017. I'd like to say something like that.
Yeah, we all came at the same time.
I'm singing a lot. But yeah, playing.
okay,
Well, welcome to.
yeah, welcome to the members. And there's a lot to do, a lot to learn, but and we're starting with the hardest part in a little while. That's the way it is. So don't worry, we'll learn and pick everything else to do. But before we do that, we have any CAB, that CAB is Community Advisory Board or C.
Sure do.
Governor's not here, but governor's not represented to the Community Education Council, but she's not here, but we do have a CAB report. A meeting that me, Arnett and Susan attended, but Susan can't give the report.
Okay, it was, so you've probably, I've been talking at full board about this. The Bellevue Intake Center is moving down here. The shelters attached is not moving down here, contrary to misinformation. That shelter has already all been emptied and people are in various shelters in various boroughs, actually. So the shelter, the intake center will open for daytime intake on August 1st. Currently, when they need to provide a bed overnight, like if someone comes late, or if there is for some overflow reason not a bed available, or if somebody needs assessment, assessment beds can be used for up to 21 days. So if someone needs a bed overnight, they are bringing them down here because the building on 30th Street is just not safe. And then what they do is they take people back in the morning. So it's being used at night. The intake, like I say, the intake center is not moved down here yet. Some residents are very, very concerned about the impact. I think to put in context for those who don't know, the facilities where the intake is moving on 83rd Street used to be about a 200-bed shelter for adult men from all over, some for Rikers, various, we have people in shelters who are actually working, there's various people. And then right around the corner on Bowery was Kenton Hall, which was about 100 single adult men with behavioral and health problems. So those two shelters have been emptied. The Bowery facility is going to be an intake center for adult families. That's no young children. And the 83rd will be for adult single male. It says some residents are very concerned about the impact. We're particularly asking DHS police are patrolling the blocks, but they are only for people who are who are part of the facility, associated with the facility. So it's really not much to patrol yet. And one of the problems that people who have concerns is they're actually conflating the fact that there are homeless people on the street now with somehow conflating that with the fact that people who are homeless are coming here. Personally, I think many of us actually feel it will be less of an impact because people are going to be coming here and then mostly transported. The total number will be less. And, it's a diverse population, like we used to have the population at Bowery was all men with behavioral health problems. Now you're going to get a whole variety. Some are people who are working and have been evicted and, well, evictions are mostly families, but they're just various reasons. So we'll see August 1st. The next CAB meeting will be in September. So by then people will know what the impact is. And Arnett may even say that if I'm leaving anything out.
No, nothing.
Any questions about it? Okay.
Great, okay, so now comes a discussion about our district needs statement. We have been worked, for those of you, it's your first meeting, we haven't worked on this since May, I think. We started talking about it first at our first meeting in May. This is something we do every year on the timeline, and discussion always starts in May. So we have color.
Can we talk a little bit about what it is?
Yeah, we're gonna talk about it, no, okay, you talk about it.
Okay, so
The same one, yeah, just
our
the same one.
budget process is basically two different related things. We have a district need statement.
Oh, Sydney.
The one from last year is on our website. And over half of the whole district need, I think, is from this committee because we cover so many areas. It is an assessment of what we have here. The format is to be as succinct as possible. We strive toward bullet points. It is for this community. We're not talking about needs for New York City. We're not talking about homeless needs. We're talking about the needs in Community Board 3. We cite, document as much as possible because without that, anecdotal doesn't carry weight. Not a policy statement, not a policy. It's very hard to do this without talking about policy, but it's not a policy statement. The other part of our budget is capital and expense priorities. The board votes and ranks and votes on 25 expense budget priorities. Expense is like programs, like after-school programs, cornerstone programs at NYCHA. It is staffing. It is parity pay staffing. It is lawyers to prevent eviction, that kind of thing. Our capital, actually, it's for city property capital. It's like with our providers, we have a lot of centers in NYCHA that need capital funding. That's a really, really hard thing because no one wants to take ownership of that. It would be a lot of our capital, our parks, schools. We always go to the Community Education Council and get their 5 top capital priorities and put those in. But it is not generally for like nonprofits. It's city properties. And these are expenses that are funded through agencies, not from city council discretionary funds, which are a different pot. And I hope that makes some sense.
So.
Well, and it's. So this district, this is what you have here is, it's based on what we, first of all, it's not, we don't write it from scratch, it's based on what we did, what we wrote last year, and then there's, a lot of changes and edits. So, so that's why what you see in front of you is, it's like the track changes versions, that's why there's always underlining or different colors, going across our strikeouts. The highlighted parts are the parts that still need some.
It's what the office went through and marked as probably needing updating.
Okay, and I highlight a couple of other things that probably needed updating. So in May, I don't know, in May, we talked about a lot of different changes or updates that we wanted to do. So some of you have come through and, put the stuff in. Sometimes the update is not possible, but there is no update or things are the same. So I'll give you something like that. So that's okay too. But in May, we're just talking about the possibilities. So this is what we have. I think the easiest thing for us is to go through it section by section. And also about the timeline. So today we are finalizing the district needs statement. We're not meeting in August. We have off in August. We will meet in September to, I guess, review the final. And then in October we vote. So that's true of also all the other committees do the same thing. They vote on their piece of it in October, and then at October full board, the full board votes on the whole thing. And then that's our district needs statement that we post and send out. And then the budget priorities, so we're not, we'll be talking about budget priorities, so. In September.
We, in September and October, we have consultations with the agencies in September. However, because this committee meets so early, we don't always have the information. We also get answers in writing from the agency, so we may have some of that for the meeting in September.
And also those consultation questions, they're pretty like nuanced and specific to, and like strategic, enough to, you know, ask questions about what we want to know. Okay, so but right now okay, so going back right now, that was just the overview of the two parts, but right now we're just talking about this. All right, so the first page is about new immigrants and asylum seekers. I added a paragraph in the beginning, as I said I would, about the change in immigration trends this year. It's not that there are a lot of new immigrants, like there, you know, those new people from Africa, and then, you know, coming from, you know, being bused up here from Texas, you know, that's not happening anymore. But it is, you know, the need this year, what's different this year is all this enforcement activity that has generated this, you know, like fear amongst the immigrants and the need for legal services, even when they go to court, you know, because they, you know, they might be, you know, detained even when they're going to court. There's things happening in the neighborhood, you know, people need to know your rights, you know, your rights under the Constitution. And you have, you know, they still have them and you have to teach them, you know, strengthen them on that. And then, oh, the other thing, which is a little sad, is that you start having to prepare families for like, you know, it's like what you would do if you died. That's what we'll do if I die, what my kid's gonna do. It's like that kind of thing that you have to talk to families about. So this is what a lot of nonprofits spend their time doing. But so I know the other thing that, you know, the bottom part I listed as it was, because it was from last year, from talking to a lot of the settlement houses, particularly Educational Alliance and University, Henry Street, so, but they never I wanted them to look at it and see if they wanted to update.
You know, Jeremy told me he sent me something and I said, I never got it, send it again, so I need to follow up on that. But also, I think what I should do is from this is when we put a question on for the agencies on their plans to increase funding for the legal services.
I know the city council did, but that's the discretion.
Yeah, that's not baseline or anything.
So all the citations for bottom cover, like the fact that there's increased ICE activity in the community.
Pardon?
That's right. Where's the citation that there is increased immigration enforcement activity in the community? And like, is there numbers to that?
I don't think you could possibly give numbers.
I mean, there is, you know, and I could see if there's a number to be on.
Yeah, Narad will probably have that. And we are, the Immigration Coalition, if you hit Narad, he can probably get that to you.
He's very busy. It doesn't even, yeah.
Well, I'm saying, you can get that turned around pretty.
I know I'm on their board.
I know, so I'm saying.
But, you know, I will. But we want to find out something that's specific to our area. Right?
Yeah, I was gonna say, do you think they really track that by area?
Yeah. They won't have anything right away on that, but they'll
Yeah, I doubt if they trap it by
yeah,
districts,
yeah.
but you could try.
Yeah, they don't, I think they. Awesome.
Want education?
we're taking the story away, right?
Yeah, we only use each story once, but we have a new one, do something with this now, what we said we wanted about.
Yes, yeah, sorry.
You know what, why this is so complicated, why this is so complicated, because it's sometimes like. When we talk about it, sometimes it's because they live here or they work here, they go to school here, so they're not all residents here necessarily. But it still affects us, right? And, you know, somehow, so that's why it's a little. Yeah, it's not that clear. But they're all part of our, well, I mean, we also view them all as part of our community. Schools. Okay, education. All the new students, I have an updated number from like this year in May, and it's actually less students. The new students, school year 23-24, and then the new students is actually less this year. It's like 500 something. I got it at a meeting, and it's just a self-reported number. So they fill out a survey and they say that they are immigrants. So they could be part of the 606, which is continuing into the next year. They could have been here 1 year or 10 years or a long time. It's just whatever they say. That's how they get the number.
Yeah, and we
'Cause they don't
have
have the
statistics that there are less children under 18. Every year there's less children under 18, so it makes sense for having have less students.
No, I'm talking about the new.
Oh, just in
The new immigrants. No, we had to ask them.
they're part of the kids under 18.
Yeah, right, no, so no, the number that I have is about new immigrant students, not all
Okay.
students.
Right here, we have 606, but you're saying it's less than that.
Yeah, no, this year it's less. It's 30 something.
You want me to highlight that or show me?
We don't need to highlight new things, do we?
Oh, this is the final draft.
The
Yeah,
highlight was just a.
right,
And what we had to update, then it should be updated by now.
So you wanna so the question is, do you wanna say like in?
Because the line that's highlighted says, the 606,
Change the number to the.
Right.
Yeah, so when we're done with the whole thing, we'll just accept, left the track changes so you can see them. And then afterward, we'll just accept.
I'm slow, but I'm here now. I got it. I don't have to do anything.
Well,
For this, I'm not doing anything for this.
What is that?
I don't know, it's a good question. Under new students, it said school year 23-24. Should that be updated?
Yeah, that's what I'm talking about.
Oh.
Yeah, that's exactly what I was talking about. So at the D1 plus meeting this year in May, I asked, Carrie, the superintendent, what were the. Cause all they talk about is immigrant students, what was the, how many immigrant students were there in D1? So she said it was about, I think, I wrote it down, so something like about 536, and it came from a survey that the families fill out. It always comes from a survey that the families fill out. They don't ask them their immigration status when they enroll.
Right.
So that's, and her number was 136 and was in May. So she said, that was at the May meeting, and she said that it was less. It was more the same time last year.
So
So this year it's less.
why aren't we using that information to update this?
I just didn't put it in yet.
Oh,
I didn't update it yet.
okay, so
It
you
needs to be
will
updated.
update, that's.
Actually, I wanted, no, the
So
other
this
thing,
is made to update.
yeah, so that was when we went to the May meeting, but I did want to ask them again if like they go or not, because this is. Maybe that was in April, I don't know, but this is June, right? July, I'm sure they probably did not do another survey, but I just want to find out how they went.
This was over them.
Okay,
Yeah, they.
Okay, so we have the information and you'll put it in now.
So, Arnett, I know you asked her about all the stuff and
Yes.
so I saw the email.
Mhm.
And what I got out of the email was that, what I got out of the email was that, there's a need, Christine, so the deputy superintendent, she says there's a need for universal, she wants to advocate for a need for universal after-school care. It's the biggest thing. She talked about the school facilities, how, also said we're not gonna have enough kids to open, to build a new school. I didn't put that in. Like what I said, no, I did not put that in, but she did say that, so we should advocate for upgrades for our schools. And, you know, for the schools that we do have, because we need them. And then she, mentioned as an example, she wanted us, was this thing happening at Nathan Strauss School, there's a proposal to like a whole, a community-based like remodeling proposal, and she's like, that's a good example of something to advocate for that would help the school as well as the community.
So they should give us these capital priorities.
That's, yeah.
But I mean, we should have them now so we can ask, because sometimes there have been times that they've given us priorities that have turned out to already been funded. So if they give them to us now, we can ask about the funding status. Not as part of the need, but as part of the questions for the agencies.
But that's all she said, she didn't say that much, that's all she
Yeah,
said.
she was supposed to send an additional email with the rendering of what the playground would look like and the estimated cost. I believe what the real ask is that from the rendering and what I think was either Parks or as someone were saying, like, they basically already have what it is that they want to do.
Which
And,
is
140. And what their design is more about having more vegetation like trees and something or other. And basically they've already committed to something, and although they got this rendering and a designer, they're pushing against what the community is wanting to and put in what they've already had, right, well, but their vision. And so it takes away from the school community, which took part of the design. And so it was more of an advocacy around maintaining what the community, the school community wanted, and still in hopes, like get what it is that had already been designed and approved, instead of having to revamp to this new idea of what the park should look like.
They could come to the community part. We could do a resolution.
Right.
But aside from that, for now, we don't need to, all we need to know now is the playground for this, so you can get an email and say, these are our capital priorities, and we should do it like before Monday. And, you know, so that we can check them with SCA and make sure that, you know, that we're not asking for something that's already funded.
Right, I'll ask her, because it was a funding issue, but I can't remember if it was, the designer, budget was too much, I can't remember what it was. So I'm gonna send her another email or call her and ask for an email detailing what the funding issue is and the ask.
And their top 5 capital priorities.
Top 5.
Yeah, but her email didn't address this other about particularly, and I don't know what to do about this need for a new school paragraph.
Well, we have an after school section, don't we?
No, need for a new, school building.
I thought we were working on the thing that we learned about the ages of the schools that we have currently, which would then coincide with what some of the capital needs are, if they wanna upgrade buildings. And improve them and all that good stuff, and when the SEA comes in, most times, the building is too old for what, to
They
modernize it.
Yeah.
So in order to get a modern school, you would actually need a new building that can accommodate what it is that our population needs now.
And I also politically, well, this is all still in courts, you know, our site that we want, and while Randy Mastro is trying to take the site away from us, I think we should leave it in at least one more year.
That's good.
This is where they're trying to take away the Elizabeth housing on Elizabeth Street Garden and put it where we want our school.
Yes.
Right.
Okay, so we wanna have this as it is, but this thing about, physical improvements and upgrades are priority given the age of the building.
Right, I think that.
The current spaces need to be, you know, better equipped. Cause that's what Christine told us. So do we wanna put that somewhere?
We could put that with the new school.
To put what?
You know, so Christine told us, you know, besides we'll never get into school, is that, which we're not gonna put in here, she did say that the current, you know, current spaces need to be, better equipped. And,
They need to give us
upgrades are a
specifics,
priority.
but they need to give us specifics.
No, so that doesn't go in here at all, as a need.
I mean,
And the
we're
need
already
of-
saying that our buildings are too old. We have that, but then for budget priorities, we need a specific need. You know, this is kind of setting it up because it talks about how old our buildings are.
Right.
Okay, so we will cross it out.
Where we're first gonna.
No, she said to cross it out.
First put out the need for school or the.
Yeah, this one about the better equipped.
No, that was a good segue into the.
Yeah, our schools need to be better equipped, you know, we, improvements and upgrades are a priority.
Yeah.
Oh,
That's a good segue into the.
Oh, okay.
But the schools are out there.
You don't think that's a good idea to put in there?
Green spaces for the benefit, you know.
Good, 2 sentences. 3 sentences.
I mean, the middle school is not happening tomorrow, if it ever happens.
No, we just want to make sure that
They
we have some control over the site.
Right. But
I would
even
take
if
out-
we ever get into school, we still need these upgrades.
I would take out that example of this as the current playground proposal because
Okay.
you don't even know what, you don't even know what the proposal is.
Yes, yeah.
Okay, so we'll take that out, you know, we'll leave the rest.
Maybe put that paragraph, well, okay, leave it there. I was gonna say, put it after the talking about the age, but it's not a big deal.
It's fine. It's something we can-
I'm struggling.
What? The second.
You just said you were like someone that's never used a computer before. And yeah, I'm gonna strike this out. And then put the,
We can delete it, no?
no, I'm gonna just strike it out.
Is it on track change? Do you have the track changes on?
Good question.
Yes,
This is a brand new computer.
Oh, thank you, Sue. I love you. 'Cause that's not. I
Are you being
take it.
sarcastic?
No, I actually take, no, because when you said it's a new computer, it took the blame off of me and I appreciate that. This is what I'm saying. Literally, I did not know what I was doing.
So-
It's like 1,500, right? Susan's 1,500?
What?
That guy, right there.
The computer.
I doubt it. Don't forget we have school. We buy under city contract.
Yeah.
I'm looking for the review section. I'm looking for the tab. It's all on that small.
No, it's the computer's new.
Yeah, I'm looking for the tab that shows review and then track changes.
Gotcha.
But this is Google policy.
Oh, this is.
Oh,
That is not-
It's not.
So now-
I should, well, who made a Google Doc?
No, this is what happened. Okay, I'm sorry. This part is my fault.
We
I
never
don't-
ever use Google Docs.
I opened up the non-limited bank I opened up the email that May gave me and it allowed me to open up in Google Docs, and that's what I did.
So the biggest problems we've had have been Google Docs, if you remember City of Yes, when all those versions.
Yeah.
Yeah, so we can't use Google, it doesn't keep the versions separate. Because then we're gonna go back and put it on the cloud in a
Right.
Word document, and it's not gonna work.
Okay, so I haven't.
Meld them all
There
together.
wasn't- I made one comment, I didn't have, specifically, like you have the, on desktop, you have like the district needs and I just open it, but since I didn't see it, I went in my email. So we can, log me off, and if you can find the district needs on the Microsoft, then I can
But
trust
that's
it.
changed.
No, she's in Google Docs.
Right, but I didn't really
She's
change
doing it
anything,
for-
I just
she's
put
doing
one
it.
note.
So Susan, but you gotta look at the email that I sent to everybody, because that's this.
I know, but you realize I don't have that on here.
Oh, okay, so when you, can't you download something onto that laptop?
Wait, I have. So I have to go through security now to open all this
Yeah,
stuff.
there was, yeah, I bypassed that.
So just.
That's with the Susan. Okay.
That's that.
Yeah.
So you download it as a Microsoft Word, then.
Yeah.
As I mentioned, we're a New York City agency, so the office is under all the security and rules and all that stuff.
In the meantime, let's.
I'll just write the note here and then. Thank you, I need that. That's gonna hold me for a little while.
Building self-esteem.
You know, the most evil word in the English language is Google Doc.
Wow.
Google Docs.
They come in there, plus, yeah.
It's not secure.
Okay, so, people can continue to take.
We are at.
Yeah, page six, page six has some footnotes, that's all. Neon is yellow. Okay, on page, page 7. Page 8 is older adults.
Oh,
More, but more.
So an older adult.
And then I have it open for you in a second.
thank you. I'm writing notes, this is, I know how to do this. I can write out.
Oh, well,
No,
that's
that's
not
not
good.
What was that? What was trying to say?
That footnote, footnote,
I'm done.
it's not a good site, it's not a good, it doesn't make sense, that's- But then we'll cross out some more stuff, this thing is important, but, you know.
Okay, we're.
So it's 57.
Okay.
I just forgot to read some stuff.
You said this, that one's.
This, yeah.
So you start with lower, so you cross out this statement is going to have focus
Okay.
stress that.
Okay, here you go. Just scroll down to where you were.
You want for loading stuff. You know, so.
Oh. You just start from the lower side or this report?
Right, so after
So-
supportive services, yeah, period, then you start with the side.
Okay, so,
What page, yeah.
7, so I'm striking out the lower east side, Chinatown, East Village. All right, stroke it out.
You're gonna keep it straight out, but you're gonna find out what's the. You got this thing.
Oh, I understand.
Oh, okay, got
You
you.
keep what you said.
Okay.
Eric, you said it would offer the sun.
There you go.
You know,
So
there-
page 7.
we already have stats, you know, about the number of seniors live below the poverty line in CD3. That's, you know, we did capture that.
Yeah, yeah. No, this is good. We just. There's one little sentence here short, because says this statement is supported by a report prepared by the.
Sure. Awesome, thank you.
That was
East Village is older than New York City.
No, the combined, yeah, actually according to NYU Langone, this.
Are you talking about the people who live here?
No, the percentage. No.
Or you're saying,
Oh, that's wrong.
maybe you're talking about the seniors, maybe you're talking about the seniors.
No, that's wrong, that's wrong, that's not how you say it. Okay, the percentage of,
Of seniors?
yeah, the percentage of the population that's older adults is higher than the New York City average.
Yes, so you should back that.
Yes, there you go.
I should put that as.
You have the highest.
older though, right? Then we found it in Lower East Side, heard that, right?
Yeah, well, the seaport is older.
See.
But you should cite it. Do we have a citation for it?
Yeah, so it's the NYU Langone report.
Okay.
Their report on CD3, and they have the New York City percentage and our CD3 percentage and our percentage is higher.
Alright.
Are you okay now with this?
Yes, this is actually done. And what happened just then? What we changing? The wording, where was that? About the older. the percentage.
Right, so Lower East Side, this village has over those.
Oh, this thing I struck out.
Yeah.
I didn't see it. Okay.
Over the population.
Yeah, the percentage of, yeah. It's, yeah, North Side is. Older adults in these three areas is higher than the New York City average. Than the New York City percentage. That is more older adults than young adults.
Oh, yeah, I remember reading that.
You don't have that one here.
So that affects you.
Yeah, I think so.
And then I see Clara made some updates, right? Clara made some updates.
Yeah.
on The numbers.
Looked up all the stuff from the Furman report, or all the citations and just updated them.
I don't see anything for North. Okay, there was an addition made, are you ready for page 10? Okay, so there was an addition made at the top. About human service facility in Nutshell. And that's to Eric. It is an overall statement about, NYCHA developments in CD3. And the social services infrastructure that's connected to
Can
it.
I ask, where did you get 20 NYCHA developments? Is that because we lost some due to PAC?
No, so we know
I'll
that
show you what
there's-
I have.
Yeah, most likely Susan would bring up is, there are some nice developments we know just by the title, but they're split up by two, so Jacob Reese Nitro,
Here,
we
so I-
one of these two.
I have 22.
Correct, and so that accounts for that, Gladys Singh was Gladys, one, Gladys two, Reese one, Reese two. Rather than doing that, it's just Jacob Reese is one actually, but
But should we
There's
keep
other
it
things.
consistent with how the city does
that's
it?
always the question you make.
So I would suggest that.
And.
Yeah.
So
It should be 22.
It can be, what's, what the city recommend.
Yeah, it's just 22.
That's fine.
I just, do I have to make the change? I just put 22. Yeah, 22.
So this is how you count them, like you count them
Yes.
each one, right, so it's like, it's within the months per month.
Yeah, that's fine.
But even if you like to talk about capital stuff and all that, these
Yeah.
are two different buildings.
Yeah.
So then would we say 7 of these developments, was it 7 and 13 or
Oh.
7 and 15 or?
We have the remaining 15.
No,
The seven arguments were in.
is it?
Um,
Because we'll give, like the Reese 1 and Reese 2 is now 1, right? The one.
right.
So why don't you check that?
I have those sources with some.
Okay, you check that, okay?
Oh, we need to
Absolutely.
update this.
Yeah, and I can give you those 7 developments, and
And then we'll figure.
then
out
the difference.
Seven.
Yeah, yeah.
Um,
Okay, so the third paragraph, we have to, under the human services in NYCHA. The plumbing, that plumbing stuff has been fixed. The ceiling falling has been fixed and raw sewage is fixed.
Will return. No, I can-
So those specific. I think we can still say, the situation, is so dire that some. Well. I'm trying to think of what we can
well, we have to
document.
say something what the situation is first, but what is dire?
Okay, where, there are intolerable conditions.
Yes, yeah, that whole thing, all of those, you know, about the ceiling and the preschool program, that's all of that is no longer true.
Preschool program, yeah.
So Eric, do you know if that in general, the situation is still true for nonprofits? You know, for,
Absolutely, absolutely.
Yes.
can we document that? Or should we go to like Henry Street or some of the nonprofits and ask them?
You talking one?
Like I said, how should,
But-
should-
Well, like, do we have an example of something that we can't get fixed in a community space?
Yes. There's just perpetual, ceiling perpetual, sadly, you know, I gotta say.
In Vercetti. So why don't we do that, you know, why don't we work together offline and to talk about an example of the problem of, it's very difficult to get capital improvements in NYCHA because NYCHA doesn't want to own them and the nonprofits can't afford it. So we'll figure out some wording for
So
that.
you will
maybe.
figure out like an egregious example. to put in here.
Yeah, we'll get
So it's-
an example from Vercetti, maybe ask David ourselves. So,
Always something.
okay, so we'll fix that, I'm glad we called it. So where we say an investment in social services. We're talking here about the facilities, it's. An investment in the facilities needed for social services is what we should say.
Yeah.
Investment in facilities. In NYCHA facilities needed for social services.
Are you ready for the next one? Your health?
Yep.
Okay, so I'm sorry I was kind of late on this, but I just only this week's email to, I was assigned, well, I assigned myself, I told myself that I would, that to email, the, CEO of, Betances, to see what their situation is. 'cause,
Oh, yeah.
If they're going to be in, you know, are they moving or what are they gonna be able to move? But I haven't heard that from her. Yeah, I haven't heard that from her. I only emailed her a couple of days ago, but I can try again.
Do they-
I'll CC.
Are they willing to take like a temporary space, right? or no?
I don't know, but you know, cause yeah, I mean, I guess they're trying to weigh all the possibilities, remember when we talked about.
We should talk about this.
You know,
I'm
they have to-
digressing.
Yeah, you have to move twice and, you know, there's a lot of help.
I'm digressing, we'll talk about it offline. I was thinking about how we found the space for the Catherine Bonte Center. Well,
Well, yeah, maybe, yeah, okay.
we got EDC to do a survey.
Oh,
I think that would be helpful. I wish I took the property right, I mean, the land right beside my building and not do a luxury tower. I think
Yes.
Mhm.
Yes.
So what are we looking at now? Well, to review all that, we're supposed to have all the changes. And yeah, just kind of finalize it, and if there's someplace we still need to, like we're picking up things that we didn't catch before. Yeah, but we should not have to review it, we may be putting in more information, we shouldn't have to be reviewing. Yeah, we've been working on this since May, is it May, April or May?
May was the first time this year we talked about.
Yeah.
So, mental health services.
So you don't have the experts in this year, this next week.
So like annually that it gets.
Yes. And it's, I believe it's reported by the city charter. I believe it's in the charter.
Yeah.
And
It makes sense, it provides a lot of direction.
About the skilled nursing. Oh, just that there's no, yeah, they
They
don't
don't have
have,
beds in the stillness.
yeah, they don't have any beds, there's no waiting list, and you know.
Oh,
Yeah.
because you have here that
what are we talking about?
with a.
13.
So you
Page
got,
So when you go to page 13, which is about the,
Skilled nursing.
skilled nursing and rehab facilities.
Oh, okay.
we just gotta strike out where it says occupancy rate with a wait list for long term. That's not true. We don't have a wait list for long term.
Okay.
So Annette, you got that?
The skilled nurse considered a movie operates at a 90.
That's kind of amazing.
Occupancy rate.
Yes.
Yeah, they.
No wait list.
What
No.
Because the demand is so frequent and ongoing that it's like, okay, once a person kind of passes away or whatever moves,
There's one person.
there's a phone call already happening at Google
Yeah.
that same day. You know, it's like one of the, it's kind of the.
Oh, so they won't keep a
So
waiting
they
list.
won't keep
It's
it.
not that there isn't a need for beds and people are at home waiting.
Correct.
They just won't create a
They're
wait.
just not creating a
They're just
data
not-
bank to
That's
capture that
a
data.
sneaky way to get rid of a waiting list. It's-
Although it's a
Yeah,
little
no
hard
waiting
to
list.
predict these things with a waiting list. I
You
mean,
know, if you say there's no
It's
waiting
either you
list,
think or you
see,
don't.
you would think that
Yeah,
there's
right.
not
It suggests a need.
Right.
over demand.
It
Right,
is over demand, they just don't have enough beds.
They just don't keep a list.
Yeah, that too, they don't keep a list, but then their long term, they don't, their turnover is rare. It's just with their rehab, they have a higher turnover because you only stay there for short term. It's the long term that they don't.
So anything else? Are we going to food security?
okay, so I'm taking out the wait list thing because there is no wait list.
Right. So as far as yeah.
It's just like that, it's-
You know, maybe we're due for an update from the state of journey, state attorney general about the healthcare facility. We haven't gotten an update, yeah. We haven't gotten an update probably in 2 years or so.
Yeah, I'll look at the last year or so.
But don't say.
Ah.
Wait,
By the way, update on Google Meet, our new chairperson is Robin Olivares. For Google Meet.
Yeah.
Just a FYI, that's the update for the staff.
That's why she's too busy to be here.
I texted too, I think she was.
She sent me an email today, but she about district needs, but she didn't. Say she was coming, she said.
Okay, so we're on page 15.
She wants to take 15.
homeless population.
Okay, so 15, this box has the story that we were talking about. Everyone should look at the story and see if that's what.
You know, I think for that top here, that top line, I think would be really good if we could make a map to show them.
And describe what map you're talking of the Lower East Side, which is that.
Well, of this, we should make a map, we should take a base of Community Board 3 and show these areas that you're talking about.
Yeah.
The percent of the 23.4% area, the 17.4% area.
Oh, I get it.
Oh, and the
Where the-
15.9%.
The food
Oh,
areas.
Yeah.
That's visual.
The food insecurity part.
You'll just have to give us, I think, exact boundaries, and we can make them.
That's pulled from the Manhattan profiles.
There's a footnote here.
So,
Oh, okay, we'll use that then.
was that?
No.
Thank you.
Was, there's a little,
Where's the
little number, there's a number.
Oh, you're right.
You got your own fee.
You're right, you're right.
The only difficulty with that might be when we're talking about the East Village. Because while in total, that's the percentage for East Village, but on Avenue D and Avenue C, it skyrockets
Really?
very much. So that percentage, would we be concerned that that
So
percentage?
that's why I
has to
wanted
be-
to know the areas, because the west part of these villages are highest income. We have a map, but we already have a map of that, it's showing that. So if I could, if there's citation shows the boundaries, that's why I asked for the boundaries.
That's the.
Because we also we have an interactive map on our website that shows the environmental justice area. So we should use that to overlay this.
Oh, great, I think it's a good suggestion.
Right, so. So this map is for the district needs or just another project?
No, I think we should put a little map right here.
Oh, okay.
And then. Is there any more we wanna do on the food insecurity?
The story will go right to everybody.
And then in the homeless section, I updated all of that and it could see the trend changes. I thought it was really significant that the Hope Survey, highest it's ever been since it started.
And is that for this area or?
No,
is it-
they will not give it for this area. Sometimes I can get it down to Manhattan, which I'm gonna continue trying to do. They cite confidentiality, although I think it's a pretty big area to be confidential, but they cite.
Yeah, so, I do recall, in May when we started talking about this, I have to look back at the notes, but we had some ideas about how. It wasn't like updating, or the other idea we had was more just like rearranging it to make it. Some things like more highlighted or not just like a whole complete list of things. But I'll look back at that. I didn't do any of it because I thought we needed to do this first and we're confusing the two things at once. But once we do this, I'll see if that, I can look at it and see if it makes sense and be sure to, you know. So it's just a matter of reformatting the way we think, it's not like the information. But, no. So that's what we had discussed at the time. Okay, are there any other questions about this? Oh, you know this map, do you want us to do it or there's so much to office and do things?
Yeah, we can.
It's on.
I just assumed that, no, you wouldn't know how it's. I wouldn't know how to do it. That's what we hire people for.
Has it hired people before?
Yeah.
You won't get.
I just assumed no one on the committee could do that.
Well, you have someone who can,
What?
you don't have anyone that.
But no, it's a huge GIS. I mean, it's a different mapping program that planners use.
It's like Adam can do it.
I can do it in our
We have.
And where?
Yeah.
different programming, yeah.
See, I didn't even, I knew you could do it.
It's a way, we've done the gradients.
See, it's not clear, but we have just got master class, we should know how to.
It might, you know, you have to like experience,
That's something he said. that he-
So,
So
I've already asked you to
it's, it's,
Probably tell me. See.
let us try first, because I wanna be able to make sure it can go on our website, that kind of stuff. And it's great to have two experts to lean on, but first thing we need to do is get these, you said the boundaries are in the citation, right?
Yes.
Cause we have an existing map, and I don't know if on our website already, and I don't know if we can do an overlay on that, cause it's an interactive one with an environmental justice area.
Mhm. So we have a starting point that we're using is,
It shows nitrogen developments, it shows the EJ area, it's under resources if anyone's interested.
It's a really good map.
Pardon?
It's a really good map.
That one we actually paid for, we have research and.
It's a really good.
I mean,
Plus
Yeah, but they-
USDA has it by census tract all the way down to the block in the street. So if we need to, we can import that information.
Yeah, that's how that was made,
Right.
because all those boundaries, sections are based on, they're all census tract boundaries,
I was kidding.
which we purposely did for that very reason.
It's a really good map.
so we are,
It's great to have that expertise, we never had it before.
okay, so we're at the end of the meeting, right? No, nothing else on this? Okay, I just wanted to announce and remind you that you should have gotten the email that there's a new member party that's coming on Sunday. Sunday from 4 to 6, all are invited, whether or not this here or old.
Yes.
It is here, and it's just for us to, socialize and, get to know each other.
It's a potluck plus for a bottle of wine kind of thing.
Yeah, so you should eat 3 pies of the email.
Yeah, Daisy's already
Daisy.
mentioned
So you can bring a beverage or a favorite, whatever you want. But you should email her so she knows.
And Andrea has also assigned chairs that you'll be not chairs, mentors to sit next to everybody at full board meetings and explain for a few months what's going on.
Oh, did she tell us yet?
What?
She told the mentees yet?
No, she hasn't. She just got an okay from the mentors.
Oh, I have to reply.
Hanging out with Herman is a lot. I freaking love hanging out with Herman. That dude is so much fun to hang out with.
Okay.
I love it.
No,
Charlie, you have a question?
No, you got, you already know.
Other new,
Huh?
new business.
You know?
Oh, wait, we're not done yet.
I'll make it quick, I promise.
Oh, so
As I
that's
was
the
mentioning before.
Nothing to be done.
There was a meeting was convened in my office yesterday. Because I had written a letter to Gifta regarding clients that were coming in and found that they were either kicked out of the staff or that their benefits were reduced by 80%. So that just rang alarm bells to me, and I immediately said, what is our directive if we're supposed to be here to help people get into these programs? What's going on? Apparently that was bumped all the way up to the commissioner level. And yesterday I had the deputy commissioner of HRA come to the office. The deputy commissioner of DSS come into the office. As well as the Department for the Aging. Cause I just figure as someone who's providing service, you know, what do we do now? And apparently, right there, within 5 minutes, the people who had those problems, it was fixed. I said, gee, how nice. But, you know, cause I'm here on the phone, it's like 4 hours, you can't get through. If you went down to Waverly, you was on a line that wrapped around the block, you couldn't get in. So, apparently, what was explained to me is that HRA had a glitch in the system, and so people are being, yeah. That's one.
Is this recent?
The meeting was yesterday.
I mean, they're glitched.
The glitch, yeah. I just think that what they're doing is they're preparing for the onslaught
Right.
of what's going to happen. If in November we don't, you know, get things that go favorably, then HR 1 is in effect immediately, you know, the day after. And so that was my major concern. And so, you know, we had a long discussion yesterday, because I really was not gonna leave until I got some kind of an answer. She didn't spread it to, you know, everyone else, but apparently Dick told me that no one else told them anything. That I was the only one that said anything. I said, well, then fine. So long as we have an answer, that's all I wanna know in terms of how to prepare. So just today, I got an email from DSS. Their outreach teams. If the community board wants, I can have them come here and do a presentation. You know, inviting other like-minded organizations to come in and listen and what's gonna happen. And what is it that you know, what's the new directive now? So that, you know, there's no confusion, there's no, and we can tell folks and not have a senior come to me in tears like what he did, saying that he couldn't go grocery shopping because there wasn't anything in his card. So, that's why I've been so busy lately, making something. You know, it's not for anything else, but it's like. It happened to a few others, and so the cases that I had that were like at the top. The deputy commissioner of HRA handled it right there on his phone. And I'm just staring at him like. I said, when I used to do this work years ago. We had a liaison that took care of our problems right away. I said, are we gonna have that back? Because we're gonna need that now more than ever.
Yeah.
So we're gonna get a liaison, folks. So, yeah, I said, I've been just on fire lately, because I know what's coming down the pipeline.
Yeah.
And things are just gonna get downright ugly before it gets any better.
Yeah.
So, in the fall, just let me know and.
When we make for September?
Yeah, if the problem still, you know, if it's still something that we need to publicize,
It will be, I can get ahead of it.
should let.
That's what I'm.
We should talk, in August.
Let's do that. I like.
Yeah, I mean, and because that's, taking care of seniors, I think is paramount, but there's so many other things like the ending of, the extensions for Medicaid.
That's
And
a problem, yes.
The essential care plan is going to
Yes.
kick off, I can't remember how, the number, it was an astronomical number of folks that will no longer have.
Well, I mean, you talk about $96 million being cut. Come on.
So.
And
for
on
the
top of that, you're gonna see the sunsetting at November, most likely. Of various rental area utility over your offsets.
Right.
So that sunsets at the same time, so there's not gonna be money for food, there's not gonna be money for rent, there's not gonna be money for utilities. And you're not gonna have money for pharmaceutical support across the board. So each of these is hitting at the same time.
So for the budget consults, what we did was do what we always do is have like one, what we call boilerplate question that we ask every agency. And that is about how the agencies are planning both for all these cuts, plus these efficiencies that the mayor is trying to find. So that's gonna be on the agenda for every agency to give information.
Now, we were also told that aside from talking to our locals, we need to hit the state. And hit them hard, because they're not, it trickles down, so,
Yeah, and the state is not aware, cause I sometimes go on Facebook Live and I just talk about things. And immediately after I learned about the essential care plan being off, I emailed state representatives and they had there was like no one
They had
said
no clue.
anything
Gracefully.
to me, yeah, so no one said anything to me. And I was like, well, hey,
So now.
I am.
So now she-
Yeah, now she
She'll be
knows,
good.
but I'm
She'll be
saying,
very.
absolutely, but it's just the fact that, like, when you said state, like, the fact that she didn't know, like, someone needed to call her. So we need to, like, we need to.
no, we have to be the bell ring,
Yeah, I know what you're saying.
so,
Ding dong, yeah, I know what you mean.
so that's where I've been all this time. Going back and forth, because apparently we have a new administration here in the city. And the commissioners and stuff who are not aware of how, things should go, or at least in preparation for whatever's coming down the pipeline.
So it's not just the budget consults, but it's like something bigger.
It's more than that.
It's more than that.
Well, the other thing we should talk about is whether it should be a presentation here or. We'll have to figure it out. We'll have to figure that out,
Yeah.
depending on how long it is.
How about you say, yeah,
Yeah,
because
it
might be,
might be too long.
might be too, but we, like, the committee can do maybe a longer version and having a bridge for full board, cause at minimum, the abridged one, we had the long one, if anyone had questions. We would have been at the longer one and be able to, just give some context to some of the other stuff.
Yeah, we could do a lot.
Yeah, the committee.
For the board, I mean, okay, okay, so that's for a future item. All right, so we are adjourning the meeting.
Okay.
Okay,
Maylee,
yeah, you're gonna take the final roll
Yeah.
call.
Maylee,
Here,
Adam,
Yeah.
Claudia,
Here.
Eric,
Yeah.
yes. Tanisha,
here,
now, how do you say this name? Yes,
Naima,
Naima Fafana. Mary. Troy Matt,
Here.
Gravin. Grandma,
Ramya,
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 thank gosh she's not here. Andrani. Not here, Arnett Scott. Here, Ashima Green. Carmen,
Present.
alrighty, and we're done.
this one have a good evening.
Thank you.